After last month's shooting in Las Vegas, a collective GoFundMe raised more than $11 million in aid for its victims. When another mass shooting killed 26 and injured 20 in Sutherland Springs, Texas, more donor pages cropped up, raising more than $1 million. But the majority of gun violence happens outside of mass shootings. And for every one person who dies, there are 2 who survive. So what happens to the people who live?
When we look at mass shootings get a significant amount of media attention. I don't think that happens on a daily basis for regular victims every day in our cities all across this country.
Joseph Sakharin is one of the people who lived. When he was 17, someone shot him in the throat with a .38 caliber bullet.
And that's what inspired me to become a trauma surgeon and then really figure out how do you work at that nexus of medicine, public health, and public policy.
He co-authored a study in Health Affairs that looked at hospital fees for gunshot victims. The study analyzed data from 150,000 gun patients from 2006 to 2014 and found that, on average, hospitals charge $5,000 for emergency department visits and $96,000 for overnight stays. That means that gunshot injuries cost Americans $2.8 billion annually in hospital bills alone. That's before factoring in other long-term costs.
So I think it's also important to note that given the incremental costs associated with post-discharge physical therapy, trauma counseling, in-home care, and lost incomes, our results probably are an underestimate of the true financial burden that are associated with these injuries.
So who pays for this? A 2013 report in Urban Institute estimated that about half of those costs are borne by people with publicly funded health insurance, like Medicaid. Another 16% by people with private insurance, and 28% by the uninsured.
Either they bear the entire financial burden of their injuries in the form of out-of-pocket spending, or these costs remain uncovered, thereby adding to the uncompensated care provided by hospitals, physicians, and the healthcare system in general.
Because of this, Sakharin says gun violence should be treated as a public health issue when it comes to policymaking and funding for research. He points to car accidents as an example.
If you look back in the 60s and 70s, there were a significant number of deaths, and those deaths over time decreased. When we were having that problem, we didn't say, let's get rid of cars. No, we made cars safer. And I think the same thing has to happen when it comes to firearms.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.